Welcome to the Disability Clinic, the doomsday protocol for our healthcare system. I'm Dr. Van, and I'm a rehabilitation doctor that specializes in pain medicine. But you're here for the lepidopterist, aren't you?
You here for the lepidopterist, ain't you?
So, the disability that gets the most screen time in the Kingsman movies is Harry's penetrating traumatic brain injury.
Well, this ain't that kind of movie.
We're going to break down his recovery and learn about how the brain bounces back after getting shot.
Is he dead?
Yes, this should have killed him.
That tends to happen when you shoot someone in the head.
Most penetrating brain injuries, especially with projectile, bullet, are fatal. An immediate helicopter transport to a trauma hospital would probably save Harry's life here. Well, it would give him the best chance.
I need your alpha gel.
I like that the alpha gel's in the hat.
We'll go check the church.
Let's go check the church, Channing. Alpha gel does not exist. This is like a piece of Amazon bubble wrap that gets injected with magical blue and red snow globe mist that stops the brain from bleeding and swelling? I don't think so. The only thing that gives Harry any chance at surviving this type of an injury is to be rushed to an operating room where a neurosurgeon can stop the bleeding in his brain and decompress his skull so that his brain can swell without further damaging itself. If you don't die from a severe brain injury, you at least lose consciousness for a period of time. The longer you're unconscious, the worse your functional recovery is. If you regain consciousness within a week or two, the prognosis is good. If you're unconscious past 4 weeks, like you're in a coma for a month or more, you're likely to have a lot of persistent cognitive issues and require a lot of assistance after you wake up.
There are side effects: partial amnesia, regression to the younger self.
Those aren't the side effects of alpha gel, those are the side effects of getting shot in the head. In general, people with brain injury first deal with staying conscious, awake, and alert. That is the first battle. It's said that someone can emerge from a coma, which the brain has no sleep cycle, into a vegetative state where the brain resumes sleep-wake cycles. And then as someone becomes more aware of their surroundings and can interact with their environment, like pushing a call bell, they're said to emerge and become minimally conscious, which is one step away from being fully conscious.
With no idea who he was, there was nothing we could do. But now you guys are here, there's a good chance we can bring him back.
I'd agree with that. That depends on how long it's been. Brain injury recovery can take months, if not 1 to 2 years, to achieve the full potential of functional recovery. Oh, Eggsy tries to hug him. But obviously he doesn't remember who he is. And Merlin is a little bit more insightful and just kind of proceeds with more caution. Very wise, Merlin. Maybe Merlin is a doctor.
Harry, look at me.
Merlin's testing extraocular motor function, which is important when someone maybe initially gets injured, but as functional as Harry appears, like he's drawing pictures of butterflies on the walls, it's unlikely that Harry's eye movements would suggest significant pathology.
He's got retrograde amnesia. We've dealt with this kind of amnesia before.
After a brain injury, people can be intermittently confused, disoriented, and have some degree of memory loss or post-traumatic amnesia.
Harry's like a computer that needs to be rebooted.
Harry's like a computer that's been shot in the hard drive point blank.
We need to recreate a shock or trauma from his past to trigger his memory.
I hope you're right.
There is no evidence that recreating a previously traumatic event triggers the reinstatement of the brain's memories. If anything, that just might trigger more trauma with little context and confuse and agitate the injured person even more. This would be extremely agitating and unproductive. This would be very unproductive in someone recovering from a brain injury. And it also risks further injury since he could drown, and then he wouldn't be breathing for some period of time, and that would cause an anoxic brain injury. Yeah, this is just a dumb idea.
No, I'm sorry to do this. We thought this might jog your memory. You became a Kingsman agent.
He needs frequent reorientation, reminding him what year it is, where it is, who he is, etc.
I want to go home. I want my butterfly collection. I want to see Mother.
I want to see Mother. Like, what year does he think it is? It sounds like he's recessed to a younger time, but when?
There's nothing more we can do.
It's important to keep that person clean, dry, nourished, and safe from impulsive or aggressive behaviors. Also safe from over-sedating or over-stimulating activities or medication. It helps to regulate their routine and surround them with familiar things, people, pictures, music, things that make him feel comfortable and relaxed. And that's really all there is to brain injury rehab.
It's time to let him go.
Time to let him go? Like, just at least take him home.
I hate to seem rude, but I need to finish packing and get some sleep.
Well, Harry, you can't just walk away. Kingsman needs you. The whole world needs you. I need you.
Eggie.
Okay.
Whoever the Harry was that you knew, he's gone, I'm afraid. Goodbye.
Let it go. Let him go. Where are they even sending him? Are they actually sending him to like a butterfly conservatory? All right, here we go. Here's where post-traumatic amnesia ends. Baby Mr. Pickles, so cute. You just sneak into someone's room like that.
Don't panic. Just thought I'd bring you a little leaving present. He's lovely, isn't he? Would you like to hold him?
Animal therapy does work, though. Therapy dogs are the best.
Do you think I should shoot him?
You're quite mad.
What? What's the problem?
Shooting a puppy is thematically very tense and on brand for the cinematic universe, so
Shoot the
it
dog.
does work in this movie. And this is a very artful way to honor the spirit of brain injury recovery, even though it's not realistic.
No one's sick enough to shoot a puppy.
Well, what about you, Harry? You were sick enough to shoot a puppy. Do you remember? What?
Like the visual hallucinations.
It was a blank.
Yes, Harry. Yes.
I would never hurt Mr. Pickle.
Yes, Harry.
He lived to a ripe old age. He died of pancreatitis.
Post-traumatic amnesia over.
Eggsy.
He recognizes his friend. Eggsy gets his hug.
I made you these.
I like that they show his scarred eye, then him putting on his new glasses in a very dignified way. If it weren't for his missing eye, upon first glance, Harry doesn't look like he's been injured. Brain injury can sometimes be a notoriously invisible disability, and people with cognitive accommodation needs often get dismissed or not believed or presumed to be manipulating the system because they
How do I look?
normal.
You look
Like some faggot looking for an eye fucking.
I really like how, even though Harry regains his sense of self and his post-traumatic amnesia appears to resolve, he still has persistent cognitive difficulties. Like, his aim is off, he's still adjusting to the loss of his left eye, he still gets intermittent bouts of disorientation, confusion, and visual hallucinations, these butterflies. And he also has issues with attention span.
Are we going to stand around here all day? Or are we going to...
You don't want to get into a bar fight during your brain injury recovery. The first hit's bad enough. Remember second impact syndrome? A second hit to the head can be even more devastating and even fatal. It's why you shouldn't allow football players who've had a head injury to return to play until they've been cleared by their physicians.
What's wrong with me, Merlin? I thought you fixed me.
Well, I'm guessing you didn't fix him right. Well, we rebuilt your neural pathways, but it'll take time to get your coordination back.
Recovery depends on what brain tissue is still intact and functional after the injury. After recovering from brain injury, people can still struggle long-term with mood and temperature regulation, adapting to changes, overstimulation, and memory and problem solving.
Hey! Butterfly guy!
You don't look like Ginger fixed you right.
This is why people recovering from brain injuries are stereotypically portrayed as being agitated, violent, and needing sedation.
So sorry about this.
It happens, but only because the injured brain has difficulty regulating emotions and expressing itself, and responding to stress.
And the phantom butterflies?
You will experience episodes, lapses of clarity. You'll be back to normal soon.
You'll be back to normal soon? That sounds reassuring, but you should never give false hope or guarantee progress.
Is he gonna be all right?
We need to have patience, Eggsy. But there's hope, okay?
Ultimately, only time will tell how much functional recovery they will achieve.
Merlin, Harry's sick. This whole thing is my fault. I thought he was ready.
Look left for me.
There's nothing wrong with my brain.
Look right.
Testing his eye function again.
Can you remember the headline when you uncovered that spy ring at the Pentagon?
The football. England beat Germany 5-1.
Thatcher's assassination.
These questions are a much better assessment of his brain function. And those are all the highlights of brain injury recovery. Are you the banana man?
Listen.
Brain injury is one of the most complex and functionally impactful injuries in medicine. So brain injury rehabilitation is a really important field that doesn't get enough credit. Doctors usually have to do a residency in physical medicine and rehabilitation or neurology before they can practice brain injury medicine. And most people who go into it do an additional 1 year of fellowship, and they have to pass a specialty board exam. Still, it's not just a doctor who helps someone with brain injury. It takes an entire multidisciplinary team of physicians, nurses, therapists, psychologists, social workers, and case managers to maximize anyone's recovery after brain injury. I hope after watching the Kingsman movies with me, you've gained a better understanding of what brain injury is and how it's managed. If you want to get us one step closer to inventing something like Alpha Gel, hit the like button and subscribe to the Disability Clinic. Oh, and please let me know if there's any injury or disability portrayed in movies or TV you'd like me to break down. Thanks for watching. You here for the lepidopterist, ain't ya?